Maganda kung lahat tayo magiging OSH champion. Isama natin sila.
Bldg? Bldg, no? Okay, man mo nakapa-Bldg no? Basta naka-servos, naka-earth, no?
It has always been an important goal of the government to improve workplace conditions in the Philippines. In 1982, the Department of Labor and Employment prepared a concept paper creating an institution on occupational safety and health from which foreign aid could be tapped. 1984, the Japanese government responded positively to the call. 1986, an agreement was signed for a 300 million peso grant aid, a project-type technical cooperation under the bilateral grant of the Japanese Official Development Assistance Program through the Japan International Cooperation Agency, March 12, 1987. The groundbreaking ceremony was held on a 2-hectare lot in North Avenue, Quezon City, with then-President Corazon C. Aquino as guest of honor. November 4, 1987, Executive Order 307 was signed, creating the Occupational Safety and Health Center as a special department under the Employees' Compensation Commission. And on the Labor Day or May 1 of 1988, OSHC officially started being part of the government's efforts to better the working conditions of the Filipino workers.
Ikinakampanya ng Occupational Safety and Health Center ang kaligtasan at kalusugan ng mga manggagawa dito sa Pilipinas. Ito ay sinasagawa namin sa pamamagitan ng pananaliksik, pagsasanay, pagpapakalat ng mga impormasyon at mga technical na serbisyo tulad ng work, environment, measurement, PPE testing at biological monitoring. Napakabigat ng tungkulin ito kaya kami ay nagpapasalamat sa aming mga partners sa gobyerno at pribadong sektor na tumutulong sa amin palaganapin ang advokasya ng OSH upang mapanatili nating ligtas at malusog ang ating mga manggagawa sa lahat ng industriya.
Based on its mandate, vision, and mission, the OSHC champions the cause of work safety and health in the Philippines. Programs to promote health and safety of workers are carried out through the following. The Office of the Executive Director, who oversees planning, implementation, monitoring, and evaluation of the OSHC operation. Under DOLE Administrative Order Number 56, Series of 2011, and DOLE Administrative Order Number 407, Series of 2017, the accreditation of occupational safety and health for OSH consultants and training organizations, as well as OSH practitioners.
Alright, good morning everyone. Good morning po.
Good morning, Philippines! So, before we start with our PagOSHwag session, mag-games muna po tayo para po loosen up, no? While waiting for the other participants and guests to log in to this webinar session. The title of this trivia is Ayushka, wherein online participants will be asked to select a category and the number that corresponds to a question. And if he or she answers correctly, will receive a hard copy of the OSHC standards from the Occupational Safety and Health Center. Now, the first contestant that types and submits via the chat box below a selected word or group of words that I will be asking will be chosen as the lucky contestant. And if ever he or she answers incorrectly, we will ask the second one who submitted the asked word or words. So, game na ba? Thumbs up po. Tingnan po natin mga thumbs up po mga people. Game na po ba? Game? Alright po. So, dapat po, pabilisan po ng pag-type and submit. So, please, for our first question po na hinahanap po namin, first po, please type and submit via the chat box the complete wording of the OSHC, mga kaibigan. Please type and submit by chat box the complete wording of the OSHC. So, Mr. Jafar, who's the lucky contestant for our first PagOSHwag Ayushka segment?
All right, Sir Melvin. Good morning to all. The first person who typed in the correct answer is Mariachi Yoko Fernandez.
Ma'am Fernandez, you are acknowledged. Ma'am, can you please unmute po muna, ma'am? Hello po? Hello po, Ma'am Fernandez po? Ma'am Fernandez, are you around po? Sasagot po ba sa chat box po si Ma'am Fernandez? Parang hindi nagsasalita po sa mic po natin.
Hello, Ma'am Maria. Ma'am, ay, may problem daw, sir, yung audio niya.
Oh, sad to say. Okay, we proceed to the next player then. Dapat po kasi makapagsalita. Okay, sir. Mr. Jafar, who's our next contestant?
Okay, sir, but the next person who typed in the correct answer is, may we call on Sir Richard Deloso.
Sir Richard Deloso, you are recognized.
Yes. Good morning, sir. I'm Richard
Alright.
Deliosa.
Sir Richard Delosa, good morning po, sir. Sir,
Good morning.
para po
Opo.
sa ating Ayushka session, segment po, sir, can you
Yes
please
po.
select your category?
Safety.
All right, safety. Sir, please select a number, sir.
Number 8.
Number 8.
Number 8, please.
Right, sir, your question goes like this. Sir, it refers to any emergency, warning, or danger signposts or any safety instructions using the standard colors, sizes, and symbols. Ano po ito, sir?
Signages.
So, Richard, yung sagot mo
Safety
po ay...
signages. Safety signages.
Signages. Tingnan po natin because the correct answer is... Safety signage. May tama ka, sir!
Thank you.
So you will be able to receive or acquire one OSHC standards hard copy from the Occupational Safety and Health Center. Later on, sir, we will inform you on how to acquire your prize.
Thank you. Thank you. Thank you.
Now we proceed to our next contestant. Sir Jafar, we proceed to our next contestant. Please type and submit via the chat box the law that created the OSHC. Once again, please type and submit the law that created the OSHC. Sir Jafar, who got it first?
Still waiting, sir, for the correct answer.
Wow.
RA 11050 and 58 po is wrong. Eng po, wrong.
The law that created the Occupational Safety and Health Center.
The RA 11058 po is not correct po. Wrong po. Another answer po, please.
Once again, please type and submit via the chat box the law that created the Occupational Safety and Health Center. Sir Jafar, do we have a correct answer now?
Still waiting po, sir. Legal basis is not the correct answer po, Ma'am Daisy. Oh, Sir Melvin, we have a contestant that answers the correct question. May we call on Sir Eman Obligar to have the opportunity to answer the trivia question.
All right, Sir Eman Obligar, you are recognized.
Thank you.
So, Sir Eman, he answered.
Executive Order number 07.
Yes, Executive Order number 307. All right, so, Sir Eman, please select your category.
Safety.
All right, safety. Sir, bawal na po gamitin yung number 8 po kanina ni Sir Richard.
Okay.
So you have the other numbers except 8.
Number 1.
Number 1. So your question goes like this. Sir, elements of fire are heat, fuel, and oxygen. True or false?
2.
Is that your final answer?
Final answer.
Because the correct answer is true! Congratulations, Sir Eman. You also will be able to receive one hard copy of the OSHC Standards of the Philippines.
Thank
So
you.
with that, thank you very much for joining the first trivia. We will still have more trivia for everyone, so please stick with us throughout the session and please invite your friends and families to this webinar. We are currently live by our Facebook page at OSHC Region 6, so please share our Facebook Live post to your friends, families, and loved ones. So we still have some time. So at exactly 10 a.m., we will start with our session. Thank you very much.
It has always been an important goal of the government to improve workplace conditions in the Philippines. In 1982, the Department of Labor and Employment prepared a concept paper creating an institution on occupational safety and health from which foreign aid could be tapped. 1984, the Japanese government responded positively to the call. 1986, an agreement was signed for a 300 million peso grant aid, a project-type technical cooperation under the bilateral grant of the Japanese Official Development Assistance Program through the Japan International Cooperation Agency, March 12, 1987. The groundbreaking ceremony was held on a 2-hectare lot in North Avenue, Quezon City, with then-President Corazon C. Aquino as guest of honor. November 4, 1987, Executive Order 307 was signed, creating the Occupational Safety and Health Center as a special department under the Employees' Compensation Commission. And on the Labor Day or May 1 of 1988, OSHC officially started being part of the government's efforts to better the working conditions of the Filipino workers.
Ikinakampanya ng Occupational Safety and Health Center ang kaligtasan at kalusugan ng mga manggagawa dito sa Pilipinas. Ito ay sinasagawa namin sa pamamagitan ng pananaliksik, pagsasanay, pagpapakalat ng mga impormasyon at mga technical na serbisyo tulad ng work, environment, measurement, PPE testing at biological monitoring. Napakabigat ng tungkuling ito kaya kami ay nagpapasalamat sa aming mga partners sa gobyerno at pribadong sektor na tumutulong sa amin palaganapin ang advokasya ng OSH upang mapanatili nating ligtas at malusog ang ating mga manggagawa sa lahat ng industriya.
Based on its mandate, vision, and mission, the OSHC champions the cause of work safety and health in the Philippines. Programs to promote health and safety of workers are carried out through the following. The Office of the Executive Director, who oversees planning, implementation, monitoring, and evaluation of the OSHC operation. Under DOLE Administrative Order Number 56, Series of 2011, and DOLE Administrative Order Number 407, Series of 2017, the accreditation of Occupational Safety and Health, or OSH consultants and training organizations, as well as OSH practitioners and testing organizations for construction-heavy equipment, respectively, have been transferred to the Occupational Safety and Health Center. The accreditation team is headed by the Deputy Executive Director, Engineer Jose Maria S. Batino. The Environment Control Division, or ECD, works toward eliminating work environment hazards and risks and controlling their ill effects on workers. It conducts researches to determine the presence of harmful environmental contaminants that affects workers' safety and health. The Safety Control Division conducts continuing studies, researches, safety audits, and technical inspections in work sites, with emphasis on hazardous machines, processes, and operations. It undertakes performance testing of personal protective equipment to ensure that manufactured PPEs conform with the set standards. The Training and Public Information Division, or TPID, plans, organizes, and conducts OSH training for a broad range of clientele. The TPID also maintains a library with an exclusive collection of books, journals, researches, and materials on occupational safety and health, which aid researchers and students pursuing studies related to OSH. TPID develops various training modules and conducts information dissemination activities. The Health Control Division conducts scientific researches on occupational health and formulates medical surveillance programs to assist enterprises in the early detection of occupational diseases. The division is among the few laboratories in the country that provides biological monitoring services to assess exposure of workers to chemical hazards such as heavy metals and organic solvents. And the Finance and Administrative Division, or FAD, provides fiscal management, human resource development, procurement of supplies, and general building maintenance in support of the total operations of the center. OSHC also prides itself in its valuable contribution to policies that promote workers' welfare. In fact, DOLE has issued department orders, labor advisories. Also, the OSHC was part of the technical working group that provided technical inputs for the crafting of Republic Act 11058, an act strengthening the occupational safety and health standards and providing penalties for violations thereof, which was signed by President Rodrigo Roa Duterte on August 17, 2018, that proves to be beneficial to its causes. Serving as the centerpiece programs of OSHC on increasing awareness and strengthening commitment to safer and healthier workplaces nationwide are these two major events which are held every 2 years. Gawad Kaligtasan at Kalusugan, or GKK, is a national award given by the Department of Labor and Employment to companies and individuals with outstanding achievements on work safety and health. The National Occupational Safety and Health, or NOSH Congress, a venue for exchange of experiences and news trends on OSH. And Vision 1 Million, which aims to promote the culture of occupational safety and health as a way of life for all Filipinos. OSHC remains true to the integrity of its credo, outstanding professionalism, service with dedication, honesty and integrity, and competent workforce. Ligtas ang maingat is not just a hashtag for OSHC. It's a way of life for the people, for the workers, and for the nation.
All right, the time is now 10 o'clock. Good morning, Philippines. Welcome, OSH champions and advocates, to the Kamustahan in Western Visayas, entitled PagOSHwag Session, Episode 1 for the Business Process Outsourcing Industry, a 2-hour webinar on industry-based OSH compliance and best practices. I am Melvin, Officer in Charge of the OSHC Regional Extension Unit number 6 for Western Visayas, and I'll be your host for this activity. Together with me is Sir Jafar and the rest of the support personnel from the OSHC Central Office. So we currently have 116 participants right now who are logged in and participating in this webinar. We hope that you can still invite your friends for them to learn a lot from this activity and may win prizes later on. So moving on, may I please request everyone to pause for a prayer, which will be followed by the Philippine National Anthem.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our day. as we forgive those who trespass against us. And lead us not into temptation, but deliver us from
Mga kababayan, ang pambansang awit ng Pilipinas.
All right. Once again, good morning. So now, let's hear some kind welcome remarks from the Executive Director of the Occupational Safety and Health Center. Ladies and gentlemen, a round of applause for Engineer Noel C. Binag.
Good morning, everyone. Once
Morning,
again, we are here gathered to conduct a webinar to protect our workers. And before I proceed, may I greet our fellow OSHC advocates. First, I would like to greet our Regional Director from Region 6, Director Cyril L. Ticao, our Dole Regional Director, and also our resource speaker for today, this morning, Dr. Jeremiah Florante from the Occupational Health and Safety and Health Center, Health Control Division. And of course, to our host from our Regional Extension Officer from Region 6, Melvin Melicaton. And of course, we have with us today our Deputy Executive Director, Ma'am Nelia Granadilos. Ma'am, good morning. So sana po, tayo po we learn a lot from this webinar. We will gather information on how to protect ourselves from pandemic. And I would like to congratulate yung Region 6 for conducting this PagOSHwag Session, Episode 1 for Business Process Outsource. This is the beginning of a series of seminars to be conducted by the Region 6 Regional Office. And hopefully we can continue with this in the future again. So sana po, we are here to protect our workers from any form of hazards, especially during this pandemic period. The most popular hazard nowadays is the COVID-19. It can disrupt workplace activities. It can result into unemployment, reduction of unemployment, and lahat po iyan is in effect on our productivity. So sa inyo pong lahat, thank you very much for joining and magandang umaga.
Thank you very much. Also, Executive Director Noel C. Binag for warm welcome remarks. Next, let us be inspired and driven with passion by an inspirational message from the Regional Director of the Department of Labor and Employment Regional Office 6, ladies and gentlemen, proudly Ilonggo, Engineer Cyril L. Ticao, via the video message.
Good morning, everybody. First of all, I would like to express my gratitude to the Occupational Safety and Health Center, headed by, of course, by their ever dynamic Executive Director, Noel Binag, for this initiative. In this trying time, the government is still trying its best to extend its assistance, and this Occupational Safety and Health Session via webinar is a concrete example. We must still continue to educate our stakeholders on the importance of occupational safety and health, even in the new normal condition. It is because safety cannot be compromised, especially in this time. Let me also thank all the participating companies and organizations who participated here today. The public information campaign is very timely. I believe that for us to develop safety and health advocates, we should always start from making people aware of the importance of these practices in the workplace. In this gathering, you will have the opportunity to learn from our speakers and learn from the best practices in the industry. In the year 2018, marked a historic event for the safety practitioners and advocates because of the passing of Republic Act 11058, or the Act strengthening compliance with occupational safety and health standards and providing penalties for violation thereof. This law is a manifestation that the safety of our workers in their workplace is of great importance. We also recognize in the department that our vision for a safe workplace for all workers could not be achieved without your cooperation and help. This vision and goal will take more than just our effort. We have to be united, and with this kind of gathering, we are one step closer to that goal. On our end, we are currently in partnership with DTI in conducting monitoring of establishment in compliance with the interim guidelines of DTI and the Department of Labor and Employment on workplace prevention and control of COVID-19. This is to protect our workers from contracting the virus when they are at work. We make sure that every worker is protected from unsafe practices. Again, we do not compromise. And with this advocacy campaign, it is our hope that you will walk out from this venue with the passion to promote safety and health in your workplace. We hope that you commit and improve your policies, especially about the health issues that will be discussed in this training. So with that, I would like to once again thank everyone. Your presence here today shows your desire and commitment to your respective organization. After all, we are bound by our commitment to serve. We are here for a greater goal, and that is for every worker to have a safe workplace. Mabuhay ang mga kagawang Pilipino. Maraming salamat. Good morning, everybody.
Thank you very much, Dole Regional Director Cyril L. Ticao, for your inspirational message. At this time, may I have the privilege to acknowledge the participating organizations who are with us right now. First, let me acknowledge my co-workers from the Occupational Safety and Health Center, the awesome REU representatives throughout the country, to Jaro, my Dole family members, my fellow public servants from various government agencies, the Western Visayas OSH Network, the Safety Organization of Negros Occidental, the Boracay OSH Network, Tri-Safety, Coshimap Western Visayas, RBA, Ethos Corporation, Savant Technologies Incorporated, Sprout Solutions Incorporated, Maxicare StarTech Iloilo, Philippine Red Cross Iloilo Chapter, Callback Sales and Marketing, Legato Iloilo, Kaifa Technology Incorporated, Med Specialized Incorporated, Cognizant Technology Systems Incorporated, RMS Collect Fields and ICOR Company, ICOR Iloilo, ESC Interactive Communication Services, WNS Philippines Global Services Incorporated, Teleperformance, IXL Solutions Philippines Incorporated, Inspiro Iloilo, and the owners, safety officers, HR managers, company representatives, OSH champions, and advocates online right now, thank you very much for your active support and participation. Now we move on to the session objectives, wherein at the end of the 12-hour webinar session, participants will be able to recognize industry-specific OSH guidelines. Number 2, compare industry-specific OSH compliance guidelines versus current workplace scenario. Number 3, identify challenges in the workplace on OSH compliance. And number 4, note industry-specific best practices on OSH. And also, in order to make this session a success, may we please ask for cooperation regarding our session rules, wherein number 1, be courteous to everyone. Number 2, stay on mute if you're not talking. Number 3, don't use the meeting chat box for conversations not related to the session. Number 4, all questions and clarifications will be answered during the Q&A segment. Number 5, if you will experience any technical issues, please inform the facilitators via the chat box. And then number 6, a certificate of participation will be provided for registered participants who successfully submitted the post-activity evaluation forms later on. So we now proceed to our first topic for today. Please take note that all your questions and clarifications will be addressed later on during the Q&A session. Our resource speaker, who will be discussing on OSH compliance guidelines for the BPO industry, is one of the occupational safety and occupational health officers of the OSHC. Ladies and gentlemen, please help me welcome Dr. Jeremias M. Florante.
Thank you very much. Can you hear me?
Yes po, Doc.
Thank you. Thank you very much. Allow me to share. Parang hindi ako allowed.
Wait lang po, Doc. Gawin po namin kayong co-host.
Okay, thanks.
All right.
Okay, one moment. Okay, can you see now the lecture slides?
Yes, Doc.
Okay, thank you. So, thank you. Start na tayo. Maupay nga aga Rion size. I would like to thank our Regional Extension Unit 6 for this PagOSHwag session, as this brings OSH advocacy to more people, especially in this pandemic. Today's lecture will not specifically discuss COVID-19 in the workplace. OSH compliances that must be adhered to by our companies in the IT BPM industry or information technology business process management industry. The objectives of our discussion this morning would include describing the scope and components of Bldg Department Circular number 01-08, the Occupational Safety and Health Standards, Republic Act number 11058, and Bldg Department Order number 198-18. We will also be discussing this morning the key principles in the implementation of workplace policies and programs, and the drug-free workplace, TB, HIV and AIDS, hepatitis B, and including the recently set guidelines on COVID-19. So Department Circular number 1 series of 2018 issued by the Department of Labor and Employment or the policy guidelines governing the treatment of workers in the call center industry is a reiteration of the occupational safety and health standards. It covers all workplaces under the information technology and business process management industry. As in the OSH standards, all workplaces under the said industry are required to develop policies and programs in compliance with the existing laws and regulations on workplace safety and health, components of which would include but not limited to hazard and risk prevention and control, establishment and capability building for members of the Safety and Health Committee, referral and access of workers to medical and welfare services, and roles and responsibilities of the employer and the workers that would include the development of OSH policies and programs, organization of a Safety and Health Committee, capacity building and active participation of workers in all OSH activities, and provision of applicable number of OSH personnel. The circular also contained the need for the industry players to observe social policies and the implementation of OSH in their respective workplaces. Moreover, the regional offices of DOLE are tasked to monitor and enforce this issuance in the said establishments. Again, please be reminded that the Department's Circular Number 01-08 emanated from the Labor Code of the Philippines as it has also been the basis of the OSH standards. With the advent of Republic Act Number 11058, several changes to OSH regulations and compliances has been instituted to strengthen safety and health in all private establishments, as the new law covers all workplaces except those in the public sector that is governed by a specific civil service issuance. As I mentioned earlier, the existing OSH standards is the backbone of the Department Circular Number 01-08 that came up after Presidential Decree Number 442 as amended and strengthened further by Republic Act Number 11058. The OSHS, or OSH standards, is a set of mandatory rules which codifies all safety and health orders prior to its promulgation. It has 30 rules, and most of it are applicable to the settings like that in the IT/BPM industry. Those in red are obviously not applicable to your industry unless otherwise you specifically deal with these things or you practically store them in your establishment. IT/BPM companies are required by law to provide OSH personnel with the appropriate training, depending on the requirements or number of workers present in the establishment. The law would also require IT/BPM enterprises to establish Safety and Health Committee, with its membership depending again on the number of workers and the risk category. The law also outlined the would-be duties of the Safety and Health Committee. The health of all workers in the IT/BPM establishments are ensured in Rule 1960 of the OSH standards. As depicted in the previous slides, companies are required to provide appropriate and qualified occupational health personnel to take care of the health needs of the workers. Identification of risk categories of companies, be it in the IT/BPM industry or otherwise, are not just one of the tasks of the designated safety officer. These risk categories will help establishments in the provision of the necessary OSH personnel, facilities, and programs ensuring the safety and health and welfare of its workers. However, there are facilities that remain as constant regardless of the company size and its risk classification. There are also certain reports that have to be submitted to DOLE regional offices that has jurisdiction over your companies. Furthermore, there are certain DOLE issuance that have to be checked also by our labor inspectors. These are issuances for a drug-free workplace, tuberculosis, HIV and AIDS, and hepatitis B prevention and control in the workplace. These issuances have the same components but may differ in their scope as drug-free workplace guidelines would only be mandatory for companies with 10 or more workers. Policy and program components would also be the same for the 4 issuances as well. Policies and programs on drug-free workplace and prevention and control of tuberculosis, HIV and AIDS, and hepatitis B have to be developed and implemented jointly by both the management and the workers. Components of the said policies and programs should include advocacy and the of concerns, social policy protecting the rights of affected workers, provision of necessary referral services, or access to medical services, emphasis on the roles and responsibilities of each stakeholder in the workplace, and its implementation and monitoring by the respective safety and health committee. Other health-related issuances that are applicable to the industry include, but not limited to, employment of night workers and ensuring their safety and health, setting up of lactation stations and development of breastfeeding policy, prevention and control of heat stress, prevention and control of ergonomic health problems brought about by prolonged standing and prolonged sitting. And lastly, the setting up of prevention and control measures of COVID-19 in the workplace. This latest issuance, jointly developed by DTI and Bldg, focuses on at least 4 areas of great concern. First would be increasing physical and mental resilience of the workers. Second would be reducing transmission of the disease in the workplace, starting from prior to entry to the office premises, requiring all workers to properly wear face masks and have themselves screened or monitored, and maintain at least 1 meter physical distancing, to observance of proper hand washing and regular disinfection of frequently touched surfaces, to prohibition of communal eating. Third area would be the minimizing contact rate by adoption of alternative work arrangement, especially to those belonging to the most at-risk population for COVID-19 exacerbation and non-essential workers. To rearranging workstation layout to maintain the physical distancing. And encouraging the workers and clients to transact electronically to avoid or minimize physical contact. Last area of concern would be reducing the risk of infection from COVID-19 by designating isolation area in the workplace and providing proper PPEs to attending OH personnel. Decontamination of the workplace with appropriate disinfectants, to encouraging workers not to report to work, especially when feeling sick, either of COVID-19 or otherwise. Duties of the employers in the prevention and control of COVID-19 in the workplace are also emphasized in the DTI and Bldg guidelines. Workers are also not exempted in making sure that the disease is prevented and or controlled from entering the workplace. Testing on COVID-19 was also pointed out, but has to strictly follow protocols established by the Department of Health. Employers are also required to submit report on the prevention and control of the disease in the workplace electronically. I think the Bureau of Working Conditions, they put it in their website, the WAIR, the electronic WAIR, wherein you can actually download it and indicate there the report, the number of personnel who got sick and among others. Okay. So in this time of public health crisis, I am positive that we will be able to beat this public health challenge if we are all educated and practice on what we have learned to make our workplaces safe and healthy. Together, we heal as one at permi natong tandaan na luwas gid ang permi nagahalong. Madamo gid nga salamat sa inyo pagpamati.
All right, thank you very much, Dr. Jeremiah Florante. So before we proceed with our second resource speaker for this PagOSHwag session, let's have our second round of our trivia. All right. So once again, for those who logged in late, let me inform you that the title of this trivia is Ayushka, wherein online participants will be asked to select a category and the number that corresponds to a question. And if he or she answers correctly, will receive a hard copy of the OSH standards from the OSHC. So the first contestant that types and submits by the chat box a selected word or group of words that I will be asking will be chosen as the lucky contestant. If he or she answers incorrectly, we will ask the second one who submitted the asked word or words. So once again, game na po ba? So okay, I think ready na po mga participants, mga audience po natin. Ready na po mga participants, mga audience. For the first question, please type and submit by the chat box the date OSHC was established. Once again, please type and submit by the chat box the date the Occupational Safety and Health Center was established.
November 4, 1978 is the wrong answer po, everyone.
Sir Jafar, do we have a lucky contestant now?
As of now, wala pa po, sir.
Alright, we will wait.
Please type in the complete date po with a month, day,
and
year.
Once again, the date, OSHC.
Okay, sir.
We have a lucky contestant.
We have a lucky contestant.
By the name of?
The first person who typed in the correct answer is Ma'am Hanali Tolentino.
Ma'am Hanali Tolentino. What did she type?
November 4, 1987 po, sir.
Alright, very good. Ma'am Hanali, you are recognized. Ma'am Hanali?
Thank you po.
Ma'am, congratulations po. You are our contestant for the second phase of the PagOSHwag segment. Ma'am, please select a category.
Environment.
You selected environment. Ma'am, please select a number.
Number 1.
Number 1. Ma'am, your question goes like this. Ma'am, what is the OSHS or the OSH standards permissible noise exposure for an 8-hour shift? What is the OSH standards permissible noise exposure for an 8-hour shift?
Do I have to answer?
Your answer po, ma'am? Bawal po mag-call a friend or ask the audience.
90 decibels.
90 decibels. Is that your final answer?
Yes po.
Tingnan po natin because the correct answer is... Alright, 90 decibels. Congratulations, Ma'am Hanali. Now we proceed to our second contestant. Alright. Next. Please type and submit by the chat box the complete name of the current Executive Director of the Occupational Safety and Health Center. Once again, please type and submit by the chat box the complete name of the current Executive Director of the Occupational Safety and Health Center.
All right, Sir Melvin, we have the correct answer. May we call
the lucky contestant?
May we call on Sir Bonifacio Junior Mirano?
Yes, sir.
Who type in the correct answer?
Yes, sir, I'm here.
All right, sir, please select a category.
Safety.
All right, safety. Sir, sa safety, bawal na po ang number 1 and number 8.
Yes po, sana madali lang.
Number, sir.
3.
Number 3. Sir, your question is, for 1 OSH standards, it is an occurrence or event that is unwanted, unplanned, and unexpected. Ano po yan, sir?
Accident.
Final answer po ba?
Yes po.
Alright, tingnan po natin because the correct answer is accident. Congratulations, sir.
Thank you very much, sir.
Later on, sir, we will inform you on how you'll be able to acquire your OSH standards or your prize po. Thank you very much. So that ends the second phase of our Ayushka segment. So now we proceed with topic number 2. So that in our topic number 2, our resource speaker who will be discussing the best practices on OSH for the BPO industry is the Safety Officer of Callback Sales and Marketing in Iloilo City. Ladies and gentlemen, please help me welcome Mr. Emmanuel Bldg.
Hello, good morning, everyone. My name is Emmanuel. I'm the SO for Callbox, Lead Management and Solution. So I'm honored to be part of this program. This is very helpful with regards to safety, and I also would like to acknowledge everyone who has done their time and join us today. So let me share my screen for the presentation. Sir, can you let me share a screen? Okay. So yeah. Are you able to see my screen?
Yes, sir.
Okay, perfect. So I've already indicated these are actually the summary of the guidelines that we have in the company. So the protocols that we're doing with regards to safety, this is actually the priority of the company, not just for compliance, but definitely for the people, which is the most important part of the business or of the company. So first is the objective. Definitely this is to address OSH problems in BPO companies at early stage through appropriate policy and programs, and improve work condition in existing and prospective BPO companies by providing advice on health and safety issues. So let's start with this. These are actually the table of contents. So the OSH committee, the identifying risk and hazards, and how our company or Callbox addresses these issues. So we have the committee, we have the chairman. The chairman actually is our CFO as well as our HR manager. So we have also the supervisors. Since we have a couple of shifts, we have night shift and the day shift. So there are 2 supervisors involved. And also there's the AM and PM safety officers. There's a couple of us since we have 200, at least 200 employees. Managers.
Sir Eman, excuse me, sir.
Yeah, go ahead.
Sir, it seems that your presentation is not moving.
Okay, hold on. So yeah, let's get to identifying of risks and hazards. Are you able to see the slide, sir?
No, sir.
No? Hold on.
It seems that your presentation is on freeze.
Let me check. I think we have to use that. Apologies. Okay. So yeah, is it moving now?
Yes, sir. It's okay now.
All right. So this is most likely the most common hazard and risk that we have in BPO company. So first is the musculoskeletal disorder. body pains, back pains. Like the risk factor identified are longer shift duration, overuse of computers, invariable and sedentary work, a poor working condition, a low job satisfaction, eye strain. We have likely that most of our BPO employees will have eye strain due to longer shifts, computers as well, low job satisfaction, and poor working condition. Voice disorder, although it is unlikely from the kind of industry that we have, but still, because actually we're an outsourced company, but still I've included it in here as part of our risk that has, or hazard and risk that has been identified. Hearing problems and psychosocial work stressor. So this is how our company addresses this kind of issue. We have provided them for musculoskeletal disorder. We have provided ergonomic chairs, like they're movable, adjustable, and comfortable for the employees to use. We also encourage them to take breaks once in a while, and we really discourage the use of PPAS for the employees because there are times that they're queuing. Some other are already in their pay, but they still have to wait for the PPAS to come in from the other agent. So we really discourage that. And we also do information campaigns like signages and time-to-time email reminders from safety team about how important the breaks and postures, and even reminding them the exercise taught in the HR OSH training that we've conducted. We are conducting it actually every February of the year. So we've conducted trainings for exercises, even eyeball exercises, and just normal office exercises while they're sitting. So for eye strain, we also need to manage lighting, as it should be parallel to the worker's line of sight, and there should be enough lighting in an enclosed area. And we also encourage them to do mini breaks once in a while, together with some information campaigns like signages, time-to-time email reminders, and also information about how to operate computer comfortably, including advices of looking at distance and eyeball exercise. So looking at distance actually is kind of exercise that you can always make whenever you get blurry and when you have a lot of exposures in computer. And also HR, or our human resource department, is providing free vitamin A for our employees from time to time. So it's for free. For voice disorders, so although it's likely, our scripts actually they're not verbatim. So the agents can always insert fillers if they're experiencing short breaths during calls. And room temperature as well is monitored at the level that is comfortable to the employees. So if you wouldn't believe, or if you'd believe that there are employees actually that wanted their room temperature to be very cold, or also wanted the room temperature to be just at the minimum level. But yeah, we are checking the room temperature if they're really comfortable with it, or if they're not comfortable with how cold it is. Then yeah, we align it to their most comfortable, to their ideal room temperature. And for hearing problems, the company provides each employee with a legitimate or branded headset to eliminate the risk of sudden burst. Usually, unbranded headsets have issues, and we also eliminate the sharing factor, and often that often leads to infection. So the headsets are just dedicated per agent, and earphone and headset has volume button so that the employee can adjust in accordance to their preference. And also they have sufficient breaks that allow their hearing system to rest. And employees also are encouraged for appropriate cleaning and the maintenance of their headsets, which is very important, especially nowadays that this pandemic is quite aerial. So yeah, it's really important that they disinfect their headsets from time to time with 70% isopropyl alcohol. So the best practices that we have is to reduce repetition, encourage break jobs, take more mini breaks. Mini breaks will just take like 30 to a minute. They just pause for a while. They sometimes talk to their colleagues. But yeah, we really encourage that activity. We also practice stress reduction techniques, alternate between standing and sitting, minimize stress on body, support body during work, take care of their eyes, have periodic eye exams, exercise their muscles, and reduce strain. By the way, in our office, we actually have ping pong tables. We also have billiard tables in leisure area. But at the moment, due to COVID, these are all not accessible for agent. But yeah, we had that before. And exercises also like looking into distance, temperature, comfort, and lighting. Definitely is also one of the important factors that affects the comfortability and safety of the calling agent. So this is just one actually for identifying risk and how to eliminate it. We also have a policy for drug-free workplace. So this program, this is a mandatory. This is to ensure that those qualified shall be screened and recruited to prevent determined effects, like for example, lower productivity, poor decision making, increased accidents, and more compensation claims. So yeah, which drug test use and abuse may cause in workplace. The conduct of mandatory drug testing shall be required for pre-employment, but we are also doing three kinds of testing, like random testing. So the officer and the employees may be selected at a random drug testing, an interval determined by the company. If you will, the employees actually are identified in a fair basis, and we also have for cost testing. The company may also ask the officer or employee to submit to drug test at any time. So if they feels that the employee may be in in the influence of drugs, including but not limited to following circumstances, like there's evidence of drugs on or about the if the employee's vicinity, negative performance patterns, or excessive and unexplained absenteeism and tardiness. So we would somehow recommend them to do drug testing just to make sure that they are not under the influence. And post-accident testing. So this is very important because there are accidents that would always have the people involved always has the influence of drugs, but we always do post-accident testing. So in incident or in the accident, work near miss or work accident under the circumstances that suggest possible use or influence of drugs. So we always suggest for post accident testing for employee or even officer. So callbacks, of course, will inform the officer or the employee who was subjected to drug test and test results, whether positive or negative. We will inform them of their result. Where the confirmatory test turns positive, the company as well is obliged for an assessment and evaluate the result and determine the level of care and administrative interventions that we can be extended to the concerned employees, and yeah, all the help that we can extend to the employee. But definitely all costs of drug testing shall be under the wings of callback. So this is free drug testing for all employees. For treatment and rehabilitation, since I think this is one very, very important issue as well. So for the first time, if found positive with drug test, it will be referred to a rehabilitation for in a DOH accredited center. Callbox or the company also will provide the list of at least 3 accredited facilities in the vicinity. And the company's assessment team, in consultation with the head of rehabilitation center, shall evaluate the status of drug-dependent employee, if he is really drug dependent, and recommend to the employer the resumption of employee's job, or if he or she still poses no danger, or to his co-employees, co-workers, and the workplace. So this will be our basis if the employee can still back to work, or perhaps we can compensate something. But all costs for treatment and rehabilitation of drug-dependent employees shall be charged to his account, since this is no longer part of the employer-employee. And the period during which employee is under treatment or rehabilitation shall be considered as authorized leave. So this is not forced leave or whatsoever or whatnot, but this is an authorized leave. But however, the repeated use, even after ample opportunity of treatment and rehabilitation, shall be dealt with corresponding penalties, like ground for dismissal. So consequences, any officer or employee who uses or possesses, distributes, sells, tolerates or transfer dangerous drugs or otherwise commits other unlawful acts as defined under Article 2 is in its implementing rules or IRR shall be subject to pertinent provision on the said act. Actually, any officers or employee found positive for the use of dangerous drugs shall be dealt with administratively in accordance with the provision of Article 282 and Book 6 of Labor Code under RA 9165. But I also wanted guys to, if there's someone here attending from Davao, actually we have a Davao side, and I really wanted to commend the Davao LGU because when they will do drug testing, the PDEA will always be present during the drug testing, even if it's company drug testing or so. So they can track and monitor all the will be positive. So yeah. For the HIV and AIDS policy, so the HIV and AIDS policy are this is actually a pandemic that has affected virtually every segment of population. So nearly every country around the world. So the company and its more than 200 employees is not immune to this pandemic. So we have the policy. The policy actually guarantees the non-discrimination and confidentiality protections. So we have voluntary counseling and testing programs. We also have care and support for HIV employees and prevention, education and awareness programs for all employees. It has also provisions to monitor compliance and evaluate the effectiveness and cultural appropriateness of the awareness of prevention programs. So our company empowers information campaign like what we have, what is HIV, what is AIDS, the difference between both, and why should one be tested. So the available tests that we have, what are the available tests and what are the facilities that are offering this test. So what we do do annual voluntary testing program. We usually conduct it every Valentine's days, every 14th of February, if it's not Sunday. So this is in coordination with local health office. So they bring in testing machines in the office, and we give like incentives, Starbucks coupons to the employees or the officers who will take the test. So it's kind of an incentive, but it's not voluntary. It's not compulsory. It should be a voluntary testing. For tuberculosis and prevention control, we also have a policy, separate policy. So we recognize while 80% of TB cases belonging to the economically productive individuals, it is also treatable, and its spread can be curtailed in proper control measures will be implemented. So we have TB policy program, and the purpose of this is to address the stigma attached to TB to ensure that the workers' right against discrimination brought by the disease is protected. So the facility-free access to anti-TB medicines and affected employees to referrals. And for social policy, we have the non-discriminatory policy and practices. We also have work accommodation and arrangement. The employee may be allowed to return to work with reasonable working arrangements as determined by the company healthcare provider and, of course, the DOTS or the DOTS. And the company as well provide access to social security system and employee compensation benefits under PD 626 to employee to acquire TB infection and performance of his or her duty. So we also conduct training and education, like we distribute and posting IEC materials and counseling lectures as well, including information campaigns via email. But however, due to this pandemic, most of our information campaign are just signages and posters and email campaigns. We don't really conduct at the moment large meetings. So yeah, but still the information campaign is ongoing. Also for the engineering measures, such as improvement of ventilation, prevention for adequate sanitary facilities, and observance of standard for space requirements, as well as screening diagnosis, so treatment and referral to healthcare services. And we have arranged the nearest direct observed treatment facility, or DOT, and we also adhere to their guidelines on the diagnostic treatment. So TB dots, yeah, TB dots is the answer for TB. For the breastfeeding policy, so since we have a lot of moms working in the company, so we have this breastfeeding policy. So it recognizes the importance of breastfeeding both mother and baby, and here support and promotes breastfeeding. We have provide actually facilities and support necessary equipment enable for our employee to balance breastfeeding, breast milk expression with their work, which includes we have lactation breaks. So these are actually another break on top of their usual 30-minute break. So if they're obliged to do the breastfeeding activity, then they can take this break. So it will allow mothers to express breast milk in the designated lactation station during break and as needed arise. So there's also flexibility in breast milk expression breaks. And we have the clinic or the facility where it is considered as lactation area. It's clean, private area, comfortable chair, hand washing facilities, storage for coolers and refrigerators, because sometimes they just contain it in a bottle and then refrigerate it. So they also have access to information like all women who are going to maternity leave will be provided with information on how they can combine breastfeeding and work once they return to work. So employees who are considering breastfeeding can make arrangements for the use of breastfeeding facilities and other support before going on maternity leave. She just needs to notify the HR department and the clinic of her intent, and yeah, everything will be fine. So pretty much this kind of policy that we have is enjoyed by I think 2% of our population, since most of 2% of our population are lactating parents as of the moment. So policy against harassment. So we always hear harassment in different sectors like sexual harassment or whatnot, but yeah, we have the policy for that. We should have the policy for that. So we prohibit and will not tolerate any unlawful verbal, physical, and visual harassment by an employee on following aspects like religion, sex, race, color, age, national origin, marital status, physical and mental disability, sexual orientation, medical condition, or any array of other aspects protected by applicable laws. So the objective definitely is to create a positive working environment which is free from hostile, offensive, intimidating, or harassing conduct that unreasonably interferes with an employee's work on account of any types of harassment described above. So the target of this policy is the prevention of unwelcome conducts, or we sometimes call it unsafe acts. We uphold Republic Act number 7877, or the Anti-Sexual Harassment Act of 1995, declaring sexual harassment as unlawful in the employment, education, training environment, and other purposes. So in some situation, a person may not realize that his or her behavior is inappropriate or unwelcome. So the employees who consider any person's behavior to be inconsistent with these guidelines are encouraged to tell the person that your behavior or his behavior is considered inappropriate, and request
that the conduct stop. So the person told should comply immediately and graciously with such requests, or else it will be taken into a higher level, wherein he will be called, and it will be as well assessed on what is the situation. But if an employee becomes aware of harassment or has been personally subjected to any harassment, this information should be communicated without fear of retaliation. So to the employee's manager or human resource as soon as possible. So it's already like your second attempt or a second offense. So it's no longer an excuse. For any reason, an employee would prefer not to discuss issues of harassment with these individuals. The employee is encouraged to report to conduct management of the company. So the company will then investigate the complaint and prompt for reporting. So we will not retaliate against any employee who files a complaint of harassment with the company or DOLE. So sometimes they think, yeah, that the company will retaliate to me, but no, that's not possible. That's not even an option. Or otherwise participates in any harassment investigation conducted by any of these bodies. So callbacks also have family healthcare program. The objective actually is to instill family planning or family welfare consciousness among labor and management as a key in promoting workplace productivity and improved work management relation. So we see that the welfare of the family components as a major issue of concern, and would like to address it with we really address it with full confidence. So what we do, we have family days, like we conduct annual family day and kids day out, where all activities are carefully planned to engage a family member in fun-filled activities. But as of the moment, this year, since it's scheduled on the second quarter of the year where the pandemic hits, we just did an online like TikTok competition per employee, includes their family member. And yeah, that's the initiative that we've done since the pandemic hits. And maternity benefit, we have a 60-day allowance paid for female member who gives birth through normal delivery and has miscarriage, so not just delivery, or has an accidental abortion. So a 78-day allowance is paid through cesarean birth. Maternity leave is granted as provided by the law. After the duration of the maternity leave, the employee must report to work. An extension may be granted upon presentation of valid reason, but then such extension will be classified as vacation leave or will be charged from employees remaining VL or vacation leave. For paternity leave, a lot of employees or male employees that we have are asking why they can't really take advantage of the paternity leave, since first and foremost, this paternity leave actually only applies to those that are married. So for those that are living in, we can't really give them option for paternity benefit. But nonetheless, it's granted provided by the law. Every married male employee shall be granted a paternity leave of 7 working days with full pay. And of course, legitimate spouse. Delivery shall include childbirth and a miscarriage, or an extension may be granted upon presentation of valid reasons, but then such extension will be classified as vacation leave or will be charged to employees remaining vacation leave. So again, guys, let me just reiterate, this is we're always reminding our employees that this paternity leave is just for married and of course for legitimate wife. So solo parent leave. So this is the 7 working days leave that solo parents are enjoying. It's an act of providing benefits and privilege to solo parent and their children, appropriating funds thereof and for other purposes. So it's the Welfare Act of 2000. So any solo parent or individual who is left alone, responsibility of parenthood due to several factors. And the privilege is in addition to
the leave privilege under existing laws, the leave provided herein shall be for 7 working days with full pay, consisting of basic salary and mandatory allowances fixed with regional wage boards, if any, provided that his or her pay shall not be less than the mandated minimum requirement or wage requirement, and also a 10-day paid leave for victims of violence against women and children. So any act or series of acts committed by any person against a woman with whom the person has or had sexual or dating relationship with whom or has common child, or against her child, whether legitimate or illegitimate, with or without the family abode, and will result to likely the physical, sexual, psychological harm and suffering or economic abuse, including threats, battery, assault, coercion, harassment, and arbitrary and deprivation of liberty. So we assess the situation. If it's legitimate, then we provide them the 10-day paid leave if they're a victim of VAWC. For accident, incident, and injury investigation, recording, and reporting, so WAIR, this is the monthly reporting. It is sent before the 20th of the month within 24 or within 24 hours of occurrence of major accident resulting to death or permanent total disability. It shall be reported to the DOLE regional office using prescribed WAIR, and usually including incident report or accident report from the safety officer if necessary. Right now, we're just sending WAIR online or through email, since it's more right now. There's no really face-to-face interaction for this. I just added the COVID WAIR since this is from the interim rules of the DOLE and DTI. So it's sent in the 30th of month, which includes the number of employees tested, if any, number of recommended quarantined agents, and other COVID related information. So I believe everyone is also aware that we have a COVID WAIR, aside from the WAIR that is sent to every 20th of the month. So work accident illness report stands for WAIR, not WIRE. I was just, kidding aside. So emergency and disaster preparedness. In our company, we actually have 2 fire drills. So we have one in the early quarter, which is shuffle. Sometimes it could be day shift or night shift, and the one later quarter, like 4th quarter of the year, still the same shuffles. And we also have visible direction signage for fire exits and fire extinguishers, and information campaign like bulletin boards, visible corners, like about earthquake, fire incident reminders, and other national disaster preparedness reminders. We are also conducting earthquake tests to the building since we are doing the building management. We have pillars and wall. We're conducting earthquake tests in pillars and walls every 4 years. And we are also well coordinated with local barangay officials and authorities, since they should be the first to know or to respond whether, if ever, there is a national disaster or whatnot. Cost of implementing company OSH program. This is actually something that most safety officer have problems in allotting budget, especially if the employer-employee commitment is not that good. But for this is actually last year's budgeting that we have. We have the PPE. The PPE for last year's project is just very minimal. Budget is very minimal, so we have 10 at the moment. I think we've already spent more than 100,000 just for PPEs alone. But for OSH training, we have 10,000. So this includes Red Cross training and other training activities that we have. For signages, we have 15,000. Medical examination, 175, since it includes all the employees. And for medical supplies and medicine, we have 50. For miscellaneous, this is mostly some petty cash that we have if ever there's accident or incident that will happen. So we have petty cash to use. prohibited acts and penalties sanctioned for violation of OSH. So this is included in our employee handbook. So if these are safety violations and or unsafe acts like littering and loitering. So we have first offense warning, second offense 3-day suspension, and the third offense is actually 3-day suspension, but there's we already are going to assess the situation of the agent for creating unsanitary or unsafe conditions. We also have violation of safety regulations and company creating unsafe work condition. This is actually these offenses are just examples of what we have. We have actually a lot, but these are the most common that we have already given to few of our employees, like any violation of safety regulations to the company, creating unsafe work and condition, or act of putting company and its employee at risk, as well as act that constituting to theft and robbery of company property and that of others. So for next is, I just wanted to share with you guys, since we are touching the topic of COVID, I just wanted to share how we have moved our, actually we have re-engineered our tables, chairs, and other rooms to cater the needs, or to cater the to ensure, definitely to ensure the safety. So if you're able to see my screen, can you see my screen?
Yes, sir.
Okay. Hold on. Because actually we have re-engineered our office, or we have re-engineered parts of our office to cater the need of COVID. This one. Can you see my screen?
Yes.
Okay. So if you've noticed in the picture, so we have re-engineered there. So we have, okay. So we have re-engineered our tables. This is actually the picture of our pantry. So we have re-engineered the table. We have divisions. It's just 3 people who can occupy both sides. I mean, 2 long chairs, 2 long wooden chairs. So there's division between, and they can only occupy 3 slots or 3 seats in one long table. And our cube has this division. So this is a acrylic based division that we have put in just to answer, or just to respond with the COVID, and of course ensuring the safety of our employees. So yeah, we also have office exercises. These are actually sent to the agents, like their hand exercises. We have seating exercises, neck exercises, back. So these are the information, sample of information campaigns that we're doing. These are actually in the bulletin boards or sent in their emails from time to time, and other sort of information campaigns that we're doing. And lastly, I'd also like to touch the safety rules that we're implementing, since right now we are experiencing this COVID. So these are already rules, not just guidelines. So the security guards are always checking the temperature because before they can go up the building, and they have to fill in the daily health monitoring report. It's actually online at the moment. And disinfect, wash their hands frequently with at least 20 seconds. And we also have marked entrances and then DTR, and then pantries for social distancing purposes. And one seat apart in the office. So we were actually maximizing our space at the moment just to respond with one seat apart rule. And we only have 8 person per van. And we also provide provide carpool. Sir, yes?
Excuse me, Sir Eman.
Yes, sir?
Your screen is freeze
Okay.
for now, sir. Can you flash it on screen again?
Okay. What are you seeing, sir? Okay na, sir? Is that okay?
Yes, sir.
Okay.
Thank you, sir.
So yeah, thank you for reminding me. We are always asking the agents to wear their masks, and if they're not calling, if they're not eating or drinking, they should wear their mask. And we have also put in a temporary sleeping area, making sure that they follow social distancing as well. And unnecessary talking at the moment is being prohibited. And for conference rooms like this, we only cater like 5 employees, and then we have alcohol, disinfectant, as well as we also provide work from home option for agents that are, like, for example, their barangay is in lockdown, or they have cases and they want self quarantine. So yeah, we also provide work from home option. And yeah, so I think that's about it from my presentation. It pretty much covers the most basic policies that we have in the company in response to how BPO should handle safety, as well as there's our response for COVID. Thank you very much for listening. Sir Melvin, back to you.
Hello? All right, thank you very much, Mr. Bldg, for sharing your company's best practices on OSH. Indeed, we are grateful to you and your company for making OSH not a mere compliance, but a way of life. Please stay for a short while for some questions and clarifications from our audience.
Okay.
So, all right, we're now down to one of the exciting parts of the session, the Q&A segment. So if you have any questions or clarifications from our resource speaker, right, for any questions and clarifications, you may actually speak now using the platform, or you may actually chat or submit your questions by the chat box below.
If you have further clarifications and questions, I will be sending everyone. I will have my email available to Melvin later on. Then I can send you the slides and the presentations that we have. These are just excerpts of what we really have. Frankly speaking, we have, I think, 50 pages of our OSH policies. But since we have a very limited time, these are just excerpts. I can send you over our sample policies, all of our policies in an email, and I'll have my email address available from Melvin.
Miss Haneli?
Yes, Sir Melvin. So we have received some questions on our chat box. So babasahin ko na lang, and then it's either Doc Jing or Doc Jeremiah. And Sir
Sir
Eman yung
Obligar. All right.
Okay, so there are some questions. One of the questions is knowing the fact that smoking and drinking is also high in BPO industry, how do you manage this? Any policy that would help, especially in this COVID-19 crisis? Sir Eman.
Actually have the policy for smoking and drinking, but I did not, I intentionally did not include it in here, since at the moment in Iloilo we have this liquor ban going on, and no smoking zone. We have ICAST who are implementing the no smoking no smoking areas, or checking on no smoking areas. So as I mentioned, we have the policy for that, and I can send it over in a full detail via email.
Okay, so that's it. Thank you so much, Sir Eman. And for Doc Jing, does OSHC have any programs for workers experiencing mental health issues? Are you tied up with any mental health agencies?
Okay, thank you very much, Hannah. Actually, this is a question of Mr. Marvin Guevara. I will just read the answer I posted in the chat box. The only recently issued Department Order number 208-20, or the guidelines for the implementation of mental health workplace policies and programs for the private sector. And in the said regulation, partnering with mental health professionals are highly recommended. Insofar as the occupational safety and health is concerned, in the pipeline, part of the module in one of our trainings, that would be managing emerging health issues in the workplace, we discuss workplace stress, and we are developing it actually to answer the mental health concerns. So yan, isa po yan na nagiging programa natin. Pero po sa department order, recommended po yung pagpapartner sa mga mental health professionals para at least easy yung referral system natin. Yun na po. Thank you.
Thank you, Doc. And another question, are work from home employees covered by OSH? If so, how are the standards enforced?
Okay. Thank you very much. I think this is a question of Mr. Matt Anthony. Orgia. Yes, work from home employees are also covered by OSH. And I forgot the number of the telecommuting guidelines. There is a department order for that, and it can be monitored as well. I mean, the safety officer has to find the mechanism in a way para at least monitor nila yung safety and health ng kanilang mga workers, lalo na't nasa bahay ito. At base nababasa ko, mas mataas nga raw ang stress levels ng mga manggagawa na nagtatrabaho sa bahay. Thank you po.
Okay. So, thank you, Doc. And for Sir Eman. Hold on, sir. Okay, so the question is, for Sir Eman, how about mental health programs for the BPO industry, like your company? Have any mental health programs or in place?
Specific for mental health programs, at the moment, we're working on it. But the mental issues actually, or mental health, are covered per item. For example, let's just cite an example. For example, in the harassment, so there's mental issues in there to be tackled, and the guidelines or the policies that we have also covers that. Depending on which or what kind of mental issues are we talking. But yeah, specifically for mental mental issues at the moment, we are working on the policies.
Okay, so Sir Melvin, ilang questions pa po ba yung kaya nating i-sagutin?
Kahit last 2 questions na lang po, ma'am.
Okay, and Sir Eman, how often do you sanitize your workplace daw po? That is a question from Al Destacamento.
Yeah. Well, we have actually 2 since we have 2 floors, So we have a couple of general services, and they're on arounds like the doors and knobs, or the most common places where employees are holding or touching are being sanitized every after an hour. We also use 70% alcohol and those disinfectants with DDS that are accredited or that has passed the requirement.
All right, we are down to the last question po, Miss Hanely. Thank you very much for answering the question.
Yes po. So, medyo marami-rami pa. Siguro mas maganda kung ibigay na lang din ni Sir Eman yung email address niya, Sir Melvin, para yung mga ibang question ay masagot niya through email.
All right, pwede rin po.
That's right, yeah.
Okay, so for the last question from Mr. Elmer Loretta, what sanctions could DOLE impose to a BPO company that refuses to cooperate with the LGU? Example is a certain BPO refused to conduct swab testing to their employees when 4 of them already tested positive.
I think ang dapat sumagot dito yung mga labor nasa DOLE po natin. However, let me just give an input po since LGU po ang may hawak sa ating mga yung local epidemiology and surveillance unit po ang may hawak ng ating mga COVID-19 programs and activities. It would be the LGU actually who would be penalizing or would be looking after these companies. And ang DOLE lang naman po ang mag-a-assist doon sa LGU kung sakasakaling may sanctions na ibibigay. Yun lang po.
Okay, so I think that will be all, Sir Melvin, and the questions, you can send your questions through Sir Eman's email and also to Doc Jane Florante.
All right, so this ends the Q&A segment. But if you still have any other questions and clarifications, you may actually submit them via our own Facebook page. You just leave a message, or you can actually email us so that we can direct your questions to the involved parties. All right, once again, thank you very much. That is the Q&A segment. So now we proceed to the third or last phase of our trivia. No, ito po yung pinakahihintay po halos ng lahat po. The last phase po for the trivia wherein you can win an OSH standards. So let me go again po sa ating trivia po. All right, same style po mismo tayo. So, game na po ba lahat? Game na po. Thumbs up po sa mga lahat po mismo na ready na sa ating Ayushka segment. So once again, please type and submit the asked questions. Who is the current Secretary of the Department of Labor and Employment? Once again, who is the current Secretary of the Department of Labor and Employment? Sir Jafar, do we have a contestant now?
Hello po, ma'am and sir. Please complete po with the middle name.
Manuel Torres.
Acknowledging the presence of the Regional Director of the Department of Labor and Employment Regional Office 6, Engineer Cyril Tecao. Sir, good morning po.
All right, Sir Melvin, we have the person who got it right.
Sino po, sir?
We would like to acknowledge Ma'am Pisada Sangkonon.
Ma'am Pisada? Ma'am Pisada, your acknowledge. Hello, ma'am. Hello po, ma'am. Hello po, ma'am.
Hello, sir.
Sir.
Sir, yes po. Sir Crisada po.
Sir Quesada, hello po sir.
Hello, sir. Good morning po.
Right, ikaw sir yung first participant po natin or contestant para sa third phase po. Sir, can you please select a category?
Yes, sir. Sir, safety.
Safety.
Yes, sir.
Wait lang po sir.
Out, Lodi.
Wait lang po sir. Alright, sir, can you please select a number except 1, 3, and 8?
Number 5.
Number 5. Sir, your question goes like this. Sir, this term refers to a situation caused by a condition or practice in any place of employment that could reasonably be expected to lead to death or serious physical harm. Ano po ito, sir?
Sir, imminent danger po.
Imminent danger? Is that
Yes,
your
sir.
final answer?
Yes, sir. Final answer po.
Tingnan po natin because the answer is talagang imminent danger. Congratulations, sir.
Yes, sir. Thank you very much po.
So now we proceed with our second contestant. Right po. So I will be asking the current address of the Occupational Safety and Health Center, Regional Extension Unit 6. Once again, please type and submit the current address of the Occupational Safety and Health Center, Regional Extension Unit number 6.
Facebook page.
Sir Jafar, meron na po bang lucky contestant?
As of now po, wala po. Wala pa po, sir.
Sige, hintayin po mismo natin. Ay, dapat po yung complete.
All right, sir. We have the person who got it right, sir.
Sino po, sir?
May we call on the attention of Ma'am or Sir Marilek Aquino?
Mr. or Ma'am Aquino, you are recognized.
Hello po, sir. Good morning.
Ay, hello po, ma'am. Ma'am, kayo po mismo yung second contestant po natin para sa third phase ng trivia. Can you please select a category?
Regarding po, sir, health po.
Health. Alright. Health naman po tayo. Ma'am, please select a number. Anong number po, ma'am? Number 3. Ma'am, your question goes like this. Ma'am, HIV and AIDS can be transmitted by kissing and hugging. True or false?
False po, sir.
False? Is that your final answer?
Yes po, sir.
Tingnan po natin because the answer is... Alright! Congratulations, ma'am! So ladies and gentlemen, this ends. That's it for our OSHC segment. Thank you very much for participating. We still have more upcoming PagOSHwag sessions wherein in the near future, you can still win lots of prizes and giveaways from the Occupational Safety and Health Center. So in every event, what has been opened must be closed. And to give the closing remarks for this activity, please help me welcome the Deputy Executive Director of the Occupational Safety and Health Center, Engineer Nelia G. Granadillos.
Thank you very much, Max. Thank you very much for introducing me. And good morning, everyone. This is to end our a series of the PagOSHwag Session, now episode 1. in BPO industry. And first, I would like to congratulate our OSHC REU Region 6. Max, thank you very much for hosting this. Very much attended, a lot of questions with exciting trivia. Thank you and congratulations. I know this is just the first. There will be series of sessions that will be hosted by REU6. Thank you, Max. My recognition to my boss, the Executive Director of the Occupational Safety Health Center, Sir Direct Noel Bina, good morning po, who leads us in all of this Vision 1 Million Advocates program. It's an advocacy continuing while still in the pandemic. Dire-diretso po ang aming information campaign with his leadership. Thank you very much, sir. I would like to thank our very dear Regional Director of Dole Region 6, a very good friend and very supportive of the OSH, RD Cyril Ticao. Sir, how are you po? Kamusta po?
Okay lang.
Thank you, sir, for all your support for OSHC, sir.
Welcome. Sige.
Opo, and he explained to us the monitoring done by the DOLE. They continue their monitoring, not for inspection, but for assistance, to ensure COVID prevention in the workplace through monitoring of the DTI DOLE guidelines. Thank you, sir. And we would like to thank our resource speakers, headed by our very own Dr. Jing Florante. Thank you very much, Dr. Jing. I know you're very busy as our OH physician in the center, and yet you're still here giving us the information. You clearly explained to us the standards and guidelines governing the BPOs. And it's not only BPO, but all of the standards and guidelines on occupational safety and health. Thank you very much, Dr. Jing. And we would like to thank our resource speaker from the private sector in the call center industry, shared with us the best practices that they implement in the callbox company. He explained to us not only the policies, but their programs being implemented in their company. It's a very good model for all of us in the call center. We're very pleased to hear all of these programs that you implement, sir. Sir Eman, all of the health guidelines, not only on drugs, TB, HIV, and all of this being implemented in your company, especially on the emerging and disaster preparedness as well. Sir, if you need our assistance on your COVID prevention, the DOLE and OSHC is very willing to support all of you in this endeavor for the COVID prevention. And lastly, may I thank our support group headed by Hani and Engineer Mr. Max for the trivia. Made us so excited. There is para tayong nasa, ano ba yan, meron pang pipiling 1, 2, 3, 4. And if your question would be on health, safety, and environment. Thank you very much. This is just the first of the series of episodes of webinars to be hosted. And it's not only Region 6. You can also attend po the other webinars to be hosted by other regions. It's all about for us to reach out, to give information, especially at this time of the pandemic. Now in the virtual world po, we can see the interest. Most of us can hear and listen and be informed, while at our homes through our technology. Virtually, we're learning, di ba po? So, hope to see you all again in the series of these webinars. Thank you very much for your support, for your participation, especially our participants. I know it's not only the number that I can see here registered in the webinar, but I know there's a lot more reaching out that we have reached out in the Facebook and social media. Thank you very much for your interest. We are now in the virtual world. With this, thank you so much and keep safe, everyone. Salamat po. Max?
Engineer Gadillos, for your kind words of encouragement and challenge towards a positive change for a safer and healthier Western Visayas and the Philippines. So that officially ends the first episode of the PagOShwag session in Western Visayas. But please, may I remind everyone with regards to our post-evaluation. Please click the link below found in the chat box for you to be redirected to the post-evaluation page. So once again, thank you very much for joining us via Zoom and Facebook Live. On our next PagOShwag session, we will tackle on the OSH compliance and best practices in the medical and healthcare industry. We really hope to see you again in this endeavor. To the lucky winners of our Ayushka segment, please do not leave the meeting yet, for we will be directly communicating with you on how you'll be able to acquire your prizes. To be updated on the schedule and other OSH activities in Region 6, please like us on Facebook and subscribe to our blog site. So once again, this is Melvin, together with Jufar and the rest of the support team saying, lahat tayo pwede maging OSH champion. Ligtas sa maingat at maayong adlaw sa inyong tanan. For the presentations, if you want to ask for the soft copies of the presentations from our resource speakers, can you please message us via our Facebook page, or you can email us for the copies. Thank you very much and have a great day, everyone.